I think a good doctor is someone who is caring, who is knowledgeable, and a good listener. The impact that you can have on children is tremendous. Even a small thing can make such a big difference in someone's life in the future. I knew since I was 5 years old that I wanted to be in medicine. My uncle is a neonatologist, so he was the first physician that I knew, and remember going to the hospital with him when I was really young, and that kind of inspired me. Also, there was a Fisher-Price doctor kit in the 80s, I'm dating myself, that I think everybody got for Christmas, and the stethoscope really worked, and so I just found it fascinating. I loved science as a young child, so that kind of was the direction to go in. My interest started in pediatrics. I thought I was going to go to medical school, be a pediatrician, and be a neonatologist. That's what I had been saying since I was 5 years old. And then once I was in the profession and doing my rotations as a medical student, just kind of fell in love with surgery, but still wanted to work with children. So then it was finding the area of the body that I was most interested in, which turned out to be the head and neck, and then pursuing that and going into a pediatric fellowship. Working with kids just brings joy because they're happy, even sometimes when they're not, and they're resilient. And you do work with adults though when you work with kids because they have parents. So my job is to really bridge that gap so that I can help the parents understand what it is that I can do to help their child. My most important job is helping the parents really understand what is going on and understand the recommendations, treatment. Sometimes it's surgery that's recommended. So the communication is the key, allowing them time to ask questions, making sure I'm answering those questions so that they understand what their child needs. I am taking care of their child, they're entrusting me, and that is a great honor for me. So it's not something that I take lightly. So I want them to feel comfortable, especially if I'm going to potentially operate or perform a surgery on their child. I think the reward is knowing that, or knowing when you've made a true change in someone's life for the better, and people just saying a simple thank you or knowing that they're grateful that you were able to help their child. That's why I do this job.